The Santa Barbara County Public Health Department has released the most recent data of sexually transmitted infections within the county from the last 4 years. The county says early syphilis rates tripled between 2021 and 2022, impacting young newborn infants. KSBY's Eduardo Wihon Jr. has more.
112 early syphilis cases were reported in Santa Barbara County last year. Health officials say they aren't sure what to expect this year as cases continue to rise. According to the Santa Barbara County Health Department, the increase of early syphilis in the county has contributed to recent increases in congenital syphilis, which affects the fetus. County health officials say they have had 10 congenital syphilis births within the last 5 years, with most of them occurring within the last 2 years.
The female rate and the female rate among women of childbearing age has tripled between 2021 and 2022. In addition, in 2022, Latinos had a rate of syphilis that was 3 times higher than that we see among our white non-Hispanic residents.
The CDC says babies born to women with untreated syphilis can have deformed bones, severe anemia, and brain and nerve problems. Dr. Stephanie Zamora from Dignity Health says pregnant women should seek prenatal care if they have been exposed to the disease.
It can definitely affect the fetus and lead to a condition that's called congenital syphilis, which just means it's syphilis that was contracted while they were still inside of the womb, and that can have detrimental effects on that unborn baby and the life that they're going to live.
The CDC says symptoms for syphilis are typically followed by a progression of stages that can last for weeks, months, or even years. The first stage is followed by a single canker mark that is usually firm, round, and painless.
You can sometimes have like a little bump, which we call a chancre, and that is painless. So, most often people feel pain and that prompts them to go to the doctor. But when you don't have pain and you may not see that bump anywhere in your body, you might not think that you have it.
Dr. Zamora says penicillin is commonly used to treat pregnant women. Despite the shortage of medication to treat syphilis occurring nationally, local health officials have been trying to accommodate their patients' needs.
It's definitely something we want to pay attention to and get the word out to our public as well as our providers, so that people can be more aware about syphilis.
Our pharmacy team is obviously looking at, all the time to come up with alternatives if we ever reach that point that we don't have a medication for a patient.
Dr. Zamora says the best way to find out if you have any sexually transmitted infections is to visit your primary health care physician and schedule an STI exam. In Santa Maria, I'm Eduardo Wihon Jr., KSBY News.
The Santa Barbara County Health Department says about 2 of every 3 cases of early syphilis countywide are from residents in northern Santa Barbara County.